Good morning to everybody. Today, I would like to speak about photodynamic therapy performed with a particular type of diode lamp with 460 nanometers of wavelength for the treatment of some oral mucosal disease, especially oral infection such as black eye tongue and hairy tongue and chronic caries, and a case of a particular type of inflammation disease called lichen planus, oral lichen planus. Here you are my co-authors, Ester, Argiolas, and Germano. Two words about photodynamic therapy. It is composed essentially by three elements: the presence of a photosensitizer, such as methylene blue, toluidine blue, acid aminolevulinic, the most popular, the most documented in the literature. The light with a specific wavelength that is specific for each type of photosensitizer, and generally was comprised between 600 and 800 nanometers. The light could be laser or no laser. In the presence of oxygen, the three elements react and produce free radicals that kill selectivity specific viral cells, bacterial or mycotic cells. The photosensitizer could be applied on the mucosa, like you can see in the oral mucosa, on the skin, and also by injection, especially in the treatment of tumors and malignancy. There are a lot of applications of this type of treatment and no collateral events documented, but there are a lot of type for photosensitizer, type of light, time of application, and also there are a lot of information about the time between the application of the photosensitizer and the illumination. So there are very different parameters in literature, but we can say that photodynamic therapy is a very important way of treatment. A small video to introduce photodynamic on the oral mucosa, in which you can see the application of a particular dye, toluidine blue, and the illumination with a particular type of light with 630 nanometers in this case, because it's specific for toluidine blue. The application of the dye, the illumination with the diode lamp, and the removal of the toluidine blue with the sealing water. So I would like to propose you a particular type of diode lamp called Flashmax with a particular type of wavelength, 460 nanometers. There are works in the literature about this type of device, especially for the conservative treatment of the tooth during the polymerization during the filling conservative treatment. Also, there are other works in which you can find that the association between this type of blue light illumination and the presence of riboflavin or hydrogen peroxide could be very interesting because have an effect, a bacteriostatic effect, and also bactericidal effect on periodontal pathogens. The hydrogen peroxide used in this last work is 0.25% and 3%. And other works in which you can find also other type of blue LED associated with other types of photosensitizer, in which the researchers have demonstrated the antibacterial activity against Porphyromonas gingivalis, that is one of the most important periodontal pathogens. So I would like to propose you this type of photodynamic therapy performed with this device called Flashmax in the treatment of oral infection disease, different from the periodontal disease. Especially for hairy and black-eyed tongue. Black-eyed tongue is a dark coloring of the dorsal lingual mucosa, like you can see in the picture, that is associated with the prolongation of the lingual filiform papillae, which take on a hair-like appearance. The clinical presentation is characterized by the presence in the dorsum of the tongue, not at the border and not on the tip, anterior to circumvallate papillae, and the color could be yellow, brown, the most frequent, green, white, or black. Often is asymptomatic, but sometimes is associated with bad smell, nausea, difficult to taste, and other type of condition. In about 11% of the population have had in their life the condition described, and the male are most involved. There are associations with smoke and also with the not immunocompetent patients, especially older HIV positive patients and oncologic patients. There are two very interesting review articles about this condition that make a very good picture of this type of condition, very frequent in the oral mucosa. The etiology is linked to the elongation of the filiform papillae that is caused by an alteration of the keratin desquamation process, and the color is linked to the presence of chromogenic bacteria. It is very important, the anamnesis in this type of lesion, because previous antibiotic prolonged therapies are one of the most important cause of the onset of this type of condition. Clinical important characterization is the presence of a minimum of 3 millimeters on length papillae. And there are associations with periodontal bacteria, especially Porphyromonas gingivalis and Fusobacterium nucleatum. The conventional therapy for this type of condition is the elimination of risk factors, especially the smoke, the treatment with drugs, and also the use of mouthwashing, oxidized mouthwashing, and the treatment with hydrogen peroxide 3%, and mouthwash with sodium bicarbonate, topic antibiotic, topic antimicotic, and also the supplement with vitamin B12. But today I would like to propose you some cases resolved with this type of photodynamic therapy. There are studies in which that have demonstrated that the use of blue light activated hydrogen peroxide are very useful in the treatment against Porphyromonas gingivalis and Fusobacterium nucleatum. And especially in a work, we can find that the hydrogen peroxide is very interesting, especially associated with curcumin. Case report number 1. She's a female of 58 years old patient that was submitted to a long antibiotic therapy and reported a positive anamnesis for Hashimoto thyroiditis. She had a particular burning sensation of the tongue, especially in the area highlighted in the picture, like you can see on the left side of the tongue. We have decided to perform the photodynamic therapy with the hydrogen peroxide at 3% along the tongue surface, and the illumination with the Diode lamp Flashmax for 60 seconds. After a few days, we can notice that in the left side of the tongue, we have a complete healing of the lesion, and the patient was free of symptoms and signs in this part. And it's very interesting because the other part of the tongue, not treated with the Flashmax, continued to have the prolongation of the filiform papillae. Case report number 2. It is a a 36 years old female with a particular cardiovascular disease, with cardiovascular disease and artificial aortic valve intervention. She takes cardioaspirin, and in these cases, to prevent the bacteremia, it is important to avoid the tongue brushing of the tongue. But so the tongue brushing is not recommended, but the patient referred has bad smell and also a burning sensation on the posterior part of the tongue. So we have decided to perform the photodynamic therapy with the same device, with the application in this case of a mixture of curcumin and hydrogen peroxide at 3%. After 60 seconds of application of the illumination, the dye was removed, and after 1 week, we have a very big improvement of the condition. The patient not referred bad smell. Case report number 3. 42 years old male patient that referred us non-systemic problems, but he was an heavy smoker, about 40 cigarettes a day, heavy drinker, and like you can see in the picture, the measure of the prolongation of the filiform papilla are very interesting because we have 6 millimeters of length. So we have decided, seen also the lack of the compliance by the patient to perform the photodynamic therapy. This time with the application of a mixture of curcumin and hydrogen peroxide at 3% on the tongue surface interested, and also the application of the illumination with the same diode lamp of 460 nanometers for 60 seconds. After 2 sessions of 60 seconds, so after 2 sessions of 2 minutes, at 15 days follow-up, we can have a very good improvement. And it is important to underline that the patient continued to drink and to smoke during this period. This is and a slide to resume the situation before the treatment and after the treatment. But the patient reported no burning sensation, no bad smell, and so on. So he was lost to the follow-up. Another slides in which you can find the literature about the photodynamic therapy performed with the blue light emitting diode associated with different types of photosensitizer that are very performant against Porphyromonas gingivalis that you could find in the tongue of this type of patient. Chronic cheilitis. It is a condition characterized by the presence of fissures, sometimes also bleeding, especially in the corner of the lips, but sometimes also the lower lip on the center could be affected. There is an association with the infection of Candida albicans and also by Staphylococcus aureus at 80% of the cases. I would like to propose you a case. A male patient, healthy male patient of 48 years old with chronic symptomatic cheilitis present from about 2 years and previous treated with different creams and topic drugs without any type of success. He reported also to have a burning sensation during the assumption of the food with spicy elements or salt elements. So we have tried to perform a photodynamic therapy session to have the possibility to improve his condition. So the application of curcumin plus hydrogen peroxide photosensitizer on the surface of the lip involved. After the illumination with the same type of the protocol with 460 nanometers and also the application of 60 seconds. And after 1 week, the patient was symptomatic for the first time. The lesion was smaller, like you can see in the picture. Before we have about 7-8 millimeters of lesion, and here we have about 3 millimeters of lesion. And he reported for the first time an improvement of the condition after 2 years. HPV prevalence, one of the most common sexual infection, about the 13% of the world population was being affected. In the USA, we have about the 40% of the women between 19 and 54 years old that have this type of infection. And in the oral mucosa, HPV could affect with squamous papilloma, wart, condyloma acuminata, and ecdysis that is very rare in these European countries, and also in USA, but is very common in some parts of South America. Squamous papilloma is an esophageal lesion with cauliform presentation, with association with 6 and 11 HPV. The palates are the most involved and is asymptomatic. Wart, esophageal lesion characterized and also associated with HPV 2, 4, and 40, frequent in the skin, and about the 10% of population have this type of condition. Condyloma acuminata is an esophageal lesion associated with the HPV 6, 11, and 16 that is connected with the transformation, the cancerization, and is very associated with the sexual behaviors. So the HPV is very important because the esophageal lesions are benign lesions, but sometimes it's correlated with the cancerization, especially the strict connection were described with Barrett dysplasia, cervical carcinoma, oral cancer, and 2 conditions of potentially malignant disorder, leukoplakia and oral lichen planus. I would like to propose you a particular type of case report. A 30 years old female healthy patient with an hypothesis of diagnosis of HPV lesion on the palate, like you can see in the picture on the right side of the soft palate. Previous treatment with the photodynamic therapy with the same type of protocol that you've seen in the previous slides, with 1 session of application with curcumin and hydrogen peroxide and illumination with 460 nanometers wavelength diode lamp. After the illumination was performed a biopsy for the histological examination, and also a particular swab for the evaluation with the molecular biology. The histological piece confirmed the presence of the squamous papilloma, but was not found HPV DNA. After the swab and evaluation with the molecular biology test, was not present the HPV DNA. I said, could be the effect of photodynamic therapy? We don't know, but it is very interesting case. So it's very important to document that there is another important case report in the literature in which the researchers have documented a case of squamous papilloma on the soft palate that healed after photodynamic therapy. So I would like to present you Ester, my co-author, and she speak about another type of lesion, oral lesion treated with photodynamic therapy.
Thanks. Lichen planus is a chronic autoimmune mucocutaneous condition, primarily affecting the oral and genital mucous membrane, skin, nails, and scalp. The oral lichen planus, OLP, affects approximately 2% of the population. OLP in general may arise in more than 70% of persons with skin lesions. The frequency of malignant change ranges from 0.4% to 3.3%. OLP is seen worldwide, mostly in the fifth to sixth decades of life, and is twice as prevalent in women as in men. OLP has demonstrated numerous systemic connotations, such as diabetes mellitus, hypertension, metabolic syndrome, thyroid disease, psychosomatic ailment, chronic liver disease, gastrointestinal disease, and genetic susceptibility to cancer. Cutaneous LP lesions are usually self-limiting, cause itching, and are delineated by the characteristic 6 Ps: planar, polygonal, pruritic, purplish, papulous, and plaques. The disease has an acute onset, and affected sites are flexor surface of the wrist, foramens, and legs. Interlacing fine reticular white lines, Wickham striae, often surround the skin lesion. Anderson classified OLP into 6 clinical types: reticular, papular, plaque-like, atrophic, ulcerative, and bullous. Topical corticosteroids remain the mainstay of therapy. Our case report is a 62-year-old woman came to our observation for a lesion present for about 1 year, extended to the hard palate and the upper vestibular gingival mucosa. In the anamnesis, she reported osteoporosis and hiatal hernia with gastroesophageal reflux. On physical examination, there were erosion areas of different width and depth, interspersed with erythematous and rare areas white patterns. The patients also reported the formation of bubbles that in a very short time they exploded. The negative Nikolsky sign and physical examination did not testify for a diagnosis of vesicular bullous disease. An incisional biopsy was performed in the palatine area. The subsequent histological evaluation and immunofluorescence were significant for the diagnosis of lichen planus bullous. Topical therapy prescribed with clobetasol 0.05% 2 times a day and topical nystatin 3 or 4 times a day for 3 weeks brought an evident improvement. However, an erosive lesion persisted in the area 22-23. It was decided to proceed with a photodynamic support therapy with 416 nanometer dyed light and 3% hydrogen peroxide. Mucous surface was wetted with hydrogen peroxide, then illuminated with dyed light 20 times for 3 seconds. Subsequently, the hydrogen peroxides were removed with a sterile gauze. This treatment was repeated 3 times every 7 days. 1 week later, there was an important clinical improvement. The therapeutic session allowed an almost complete remission of the lesion, unresponsive to corticosteroid treatment. 416 nanometer dyed light and association with hydrogen peroxidase and curcumin could be very useful in different types of oral mucosa disease without any type of collateral events. Clinical trial must be performed to confirm the starting results.